Understanding rheumatoid arthritis, symptoms, precautions, and managing rheumatoid arthritis, or RA, is more than just joint pain at S, a chronic autoimmune disease that can significantly impact your quality of life. But with the right knowledge and precautions, you can manage its symptoms and live a healthier, more active life. In this video, we'll break down what rheumatoid arthritis is, its symptoms, and practical steps you can take to manage or even reduce its impact. Watch till the end to learn how you can take control of your health. Let's get started. What is rheumatoid arthritis? Rheumatoid arthritis is a chronic autoimmune disease where the immune system mistakenly attacks healthy tissues, particularly the synovium, the lining of the membranes surrounding your joints. This leads to inflammation, pain, swelling, and over time, joint damage and deformities. Here are some key points about RA. 1. Autoimmune disorder. The immune system attacks the body's own tissues, especially the synovium and the joints. 2. Symptoms. Joint pain, swelling, warmth, and stiffness, especially in the mornings or after inactivity. These symptoms often affect multiple joints symmetrically. 3. Joint damage. Without proper treatment, RA can cause permanent joint damage and loss of function. 4. Extra-articular manifestations. RA can also affect other organs, like the skin, eyes, heart, and lungs. 5. Flare-ups and remissions. RA symptoms can fluctuate, with periods of intense activity and reduced activity. 6. Diagnosis. RA is diagnosed through medical history, physical exams, blood tests, and imaging. 7. Treatment. While there's no cure, treatments like medications, physical therapy, and lifestyle changes can help manage symptoms and slow disease progression. Precautions and lifestyle tips. While you can't always prevent RA, certain precautions and lifestyle changes can help reduce your risk or manage symptoms if you've already been diagnosed. Here's what you can do. 1. Maintain a healthy lifestyle. Eat a balanced diet rich in fruits, vegetables, whole grains, and omega-3 fatty acids. Engage in low-impact exercises like swimming, walking, or yoga to keep your joints flexible. Maintain a healthy weight to reduce stress on your joints. 2. Avoid smoking and limit alcohol. Smoking increases the risk of RA and worsens symptoms. Limit alcohol to reduce inflammation. 3. Protect your joints. Use proper body mechanics when lifting heavy objects. Pay attention to ergonomics at work and home. Use assistive devices to reduce joint strain. 4. Manage stress. Practice mindfulness, meditation, or deep breathing to reduce stress, which can trigger flare-ups. 5. Regular checkups. If you have a family history of RA or experience symptoms, consult a healthcare professional for early diagnosis and treatment. 6. Follow medical advice. Work closely with your healthcare team, including rheumatologists and physical therapists, to manage your condition effectively. 7. Stay informed. Keep up with the latest advancements in RA treatment and management strategies. Conclusion: rheumatoid arthritis may be a lifelong condition, but with early diagnosis, proper treatment, and healthy lifestyle choices, you can manage its symptoms and maintain a good quality of life. Remember, you not alone. Work with your healthcare team and take proactive steps to protect your joints and overall health. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe for more health and wellness tips. Together, let's take control of our health and live our best lives.